What does informed consent for atomoxetine look like, otherwise known as strattera? My name is Dr. Dutton. I'm a board-certified adult psychiatrist, and I talk a lot about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And so today we're going through atomoxetine, otherwise known as strattera, which is one of our only non-stimulant alternatives for the treatment of ADHD. So this can be a really good option for people who can't tolerate a stimulant, or for other reasons a stimulant may not be a safe option. So maybe they've had a trigger mania in the past, or maybe they have cardiac issues that make it so they can't tolerate the medication safely, or maybe the side effects of stimulants are just too much for them. Strattera is going to be similar to a stimulant, but essentially less powerful. It is a selective norepinephrine reuptake inhibitor. Similar to the stimulants, it's going to increase the available norepinephrine in the synapses between neurons. But in contrast, the stimulants are pushing out both norepinephrine and dopamine, and so they're definitely more powerful. The side effects are going to be similar to those that you can experience with stimulants, but they're going to be probably less intense because of the mechanism of action. So you can still have things like headache, irritability, insomnia, decrease in appetite, increase in heart rate and blood pressure. There can also sometimes be sexual side effects, GI upset, drowsiness, fatigue. In terms of safety risk, there is also an increased risk of SI. And even though this one is less risky with cardiovascular issues than the stimulants, there still can be an increased cardiovascular risk in those who may be vulnerable. So if they have a personal history of cardiovascular disease or a family history of sudden cardiac death, you may still want to proceed with caution when considering taking this medication versus maybe some other alternatives. Unlike a stimulant, this is a medication that you have to take every single day. And so you'll notice the effect over a few weeks. Whereas a stimulant, you can take it just one day, you'll notice the effect while it's in your system, and then it's out. As far as withdrawal symptoms when trying to discontinue this medication, I don't think that we know as much about that. But if you've had an experience with trying to get off of strattera and you want to share how it was for you, I'd love to hear about it. So after going through all of this and answering any questions that they might have, we would discuss whether or not the benefits of this medication outweigh the risks, and we would go from there. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also getting together an email list for anyone who's interested in my content, because I may have resources or future offerings that I want to be able to communicate with you all directly about. So if that's you, then send me a DM with your email. I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.